American Heart Association has been at the forefront of this issue both nationally and in Rhode Island for many years. And I want to welcome Dr. Karen Asprey now to share a few words with her, with why the Heart Association is so enthusiastic about this legislation. Dr. Asprey.
Thank you, Dr. Nunn, and I want to also thank the representatives and senators who are backing this important legislation. I've been asked to speak about the cardio-metabolic effects of sugary beverage consumption, which, as you know or may not know, several-fold higher in the U.S. and compared to other countries, and which has certainly not decreased in the last decade when you consider all the other beverages that have poured onto the market to take the place of soda. Unfortunately, research shows that people who drink these sugary beverages are more likely to suffer from overweight, as well as diabetes, coronary heart disease, stroke, and related deaths. It has been recently estimated that roughly 52,000 individuals in the U.S. die yearly of a cardiometabolic disease related to sugary beverage consumption. The risk stems from the large and rapidly absorbed liquid sugar loads, which totals about 17 teaspoons of sugar in a 20-ounce bottle and about 10 to 11 teaspoons in a can. 12-ounce can. This amount of sugar on a regular basis oversaturates the body's energy stores, causing high blood sugar over time and diabetes, and forces the liver to turn the excess sugar into fat. The liver cannot function with all the fat in its cells, so it is essentially secreted into the bloodstream as these fat-rich particles that become eventually bad LDL cholesterol, which you're all familiar with as the number one particle that elevates cholesterol and heart disease risk. So to counter these negative effects, as you've heard, several jurisdictions around the world, roughly 50, including in the U.S., like Philadelphia and others on the West Coast, have enacted sugary beverage taxes to counter these. Many have used the tax revenue, like this bill is proposing, to support public health and nutrition programs for low-income and families with need. And we're thrilled that this has now been paired with this tax will be paired with this program. What will this do? Research shows that in the lab, if you reduce sugary beverage consumption, you are automatically reducing your blood sugar, your risk of diabetes, your cholesterol, and your triglycerides. Also reducing body weight over time. It'll also reduce cardiovascular disease and the costs of these, which are headed towards roughly $1 trillion by 2035. These latter costs in terms of savings would be significant. It's estimated that $23 billion US dollars would be saved by enacting a 1 cent per ounce cost on sugary beverage. Tax rather on sugary beverage. And Rhode Island would be the beneficiary of obviously these tax savings. However, many, and you'll hear many of the arguments, have argued that this is a regressive tax. It is not. A balanced 2019 analysis by health economic experts that factored in all of the external factors, internal factors, and the price elasticity of demand actually showed that the net benefits, and I'm quoting, are possibly the highest for the lowest income consumers, who would benefit substantially from sugary beverage taxes, probably the best or the highest beneficiaries. Many have argued that people would travel over state lines. This is unlikely to happen. Most people don't shop based on where they're buying their soda. If you look at data from all the jurisdictions, actually the net effect is reformulation to lower sugar beverages and an increase in the usage and purchases of healthier beverages like water and flavored water. And then finally, I want to say many have argued that this is a paternalistic tax. However, many of the highest consumers of sugary beverages are children and teens. Data show that up to 60% of children in the U.S. consume a sugary beverage on any given day. You may say, well, there's a food label. Doesn't that deter people? The food label has not been enough to reduce sugary beverage consumptions any more than cigarette label warnings or enough to reduce cigarette usage and tobacco usage to the numbers that we have today. Other population health policies were needed and were smartly enacted in our state to drive these numbers down with no effects long-term on bars and restaurants. 20 years later, we believe the negative impacts on public health from regular sugary beverage consumption are profound enough to warrant steps beyond a food label. A tax incentive to drink less sugar paired with this program that's been discussed will promote consumption of fresh produce by families in need, improve the cardiovascular health of Rhode Islanders, reduce health costs, and really support continued innovation by our beverage industry partners. Thank you very much.